two know. What is refractory asthma?
Recurring.
Not reoccurring.
Not responding.
Not responding to therapy, remember? So same thing here. They've got hypertension. It's not responding to drugs or medications or whatever they're doing. And so this is what they try. So they're trying to maintain their blood pressure. And this has two things again. We have to put in the implantable pulse generator. So guess where that's going? Subcutaneous tissue of the chest. So you're going to be at OJH again. Okay. Yeah, those devices into that OJ. And then you have to put the leads in. Now here the leads are going into the internal carotid artery. So we're not in the heart anymore. We're going up the neck, internal carotids. And they have to put one in each side. So you'll have two codes. One for the right internal carotid and one for the left. Okay, so that's a whole other system. Device, generator in the chest, leads in the carotid arteries. They give you the codes for revision if they're coming in to have the revision of the leads or the generator. Your diagnosis is going to be Z4509, encounter for adjusting other cardiac device. I have trouble with that because they're in your carotids, but I guess it's because it's those arteries. You're in the circulatory. Anyway, that's what it would be unless what? Unless there was some sort of complication, right? Then it's going to code out to a complication. In addition to that, you'll have your I-10, because if it's not working, they probably have hypertension. Okay. So watch for that one. And then your root operation on those would be revision. Remember, whenever you get into revision and removal, your options get more general, less specific. So now you can't take it to the internal carotids. All you can do is take it to an upper artery. Okay? The approach is percutaneous and you still have your stimulator lead as your device. Here's my other favorite one. This is the filet mignon procedure. Now, a lot of fillets anymore don't have that bacon around it. But that's what I think of when I see this, because they're taking the heart and they're wrapping a muscle around it and then sticking electrodes on it. So this is called dynamic cardiomyoplasty. Okay. I had some nurses look at me when I talked about this and basically were laughing at me like they'd never seen it. I'm like, I'm just telling you what they tell me. So I had to go back and check it out, and apparently it does exist. I don't know where they do it. I don't know if it's in some foreign country. But anyway, they do have this procedure. What they do is they elevate the latissimus dorsi muscle and wrap it around your heart. They're not cutting it out, so it's going to code out as a transfer, because part of it's still attached to its original location. They're just lifting it up and wrapping it around the heart. Okay? So that's a transfer of a muscle of the trunk. And then apparently in order to do this procedure, they have to remove a rib. So you're so you have a resection of the rib, either right or left, depending on which side they're doing. And then you have insertion of the cardiac leads into the pericardium to stimulate it. So I don't think you'll run into it, but if you do, I want you to remember you heard it here first. Yeah, wrapping the muscle around the heart, just like that old bacon, right?
Is that filet mignon procedure?
Yes. Okay, at the top of page 435, this is our heart transplants. Heart transplants are not that hard to code. You just got to know whether it's allogenic or syngenic. You remember the difference between that? Allogenic meaning it comes from another human. Syngenic meaning that it's very closely related genetically. So I don't know too many that are going to give up their heart for you, but maybe if you were in a car wreck with your twin or whatever, your child, it would be horrible. Or you're the mother. Let's go the other way. The child lives. we're gonna give them our heart. Anyway, I don't know how else you'd get Syngenix. Who's gonna give up their heart?
Maybe if somebody died and it's almost that, I guess.
Same time, the car wreck, I'm telling you. And maybe it was a double suicide attempt or something. We could make up a whole problem on this, couldn't we? Get ready. Oh, Lord.
External barcode.
Yeah. Okay, so anyway, again, they're going to have to use cardiopulmonary bypass when they do this, so you would code that as well. But I kind of wanted to look at this problem that they've listed here just to show you how one little simple paragraph can turn into 5 or 6 codes, even though I'm sure you already know that. But let's look at this one. A patient underwent orthostatic cardiac allograft transplant. There's your first code for the heart transplant. Okay? They utilized cardiopulmonary bypass. There's a second code because you have to code that. We know it was an open procedure because it tells us it was an open sternotomy. Because excessive transfusions were required, because they had to give them a lot of blood, a Maharker, whatever it is, catheter was inserted percutaneously through the femoral vein, but it ended up in the inferior vena cava. So this, you're going to have to code that insertion of that catheter because they were administering blood. So in that case, remember, we're going as far as it went. So that would be insertion of a catheter into the vena cava. This time it's inferior instead of superior vena cava. It says the patient also had an intra-aortic balloon pump for counterpulsation, which was left in place after the procedure. Ordinarily, we wouldn't code that. But because they had to keep going with it after the surgery, you're going to code that. And then a pacemaker was also left in place due to coagulopathy. So again, something that we wouldn't ordinarily code, because it's still there, we got to code that. So there's your codes for all of that. That balloon pump is going to be a cardiac output. And then the other two, performance of the pacing and performance of cardiac output. Okay, so look at that last paragraph there before procedures on aneurysms. Tells you, this is where it's talking about. Typically, auxiliary procedures are done solely to support the performance of a surgical procedure and are not coded separately. The exception is cardiopulmonary bypass. But if you read on down, it says in this case, the transfusion catheter, the intra-aortic balloon pump, and the temporary pacing were all required to be continued beyond the operative episode of the heart transplant. And so they're not just temporary auxiliary procedures, and therefore they have to be coded.